Phoenix and welcome to my YouTube channel. This is your girl Catherine Maina. Please call me Kate Mimi. I know you have questions. Where have you been, young woman? What have you been doing, Kate? You've not been uploading videos. Chill out. Don't worry. I'm here. That's what matters, isn't it? Anyhow, if you're new to this channel, karibu sana. If you're an existing subscriber, thank you for sticking around. And what do I do on this channel? I try and talk about issues relating to healthcare workers, especially nurses. I also talk a lot about immigration. Why? Because I am a nurse from Kenya working in the United Kingdom as a clinical nurse specialist in Renal. So definitely I want to talk about it because this is a conversation that everyone is having at the moment. Besides that, I am a freelance writer. Besides that, I talk a lot about complex medical language and trying to break it down into palatable bits that lay people can understand. Okay, I really love teaching, so I do a lot of that. I write a lot. Kindly follow me on Facebook and let's talk. Anyway, enough with that. I'm here to answer questions from renal nurses in Kenya. I am interacting with a lot of you, and the question that you're asking me is, Kate, how can I be a nephrology nurse in the United Kingdom? If I came and worked in the United Kingdom, am I going to get the same salary as any other registered nurse, or do I have different perks? What is happening? Catherine, give us details. Yes, I'm here to give you details. Yes. Anyhow, so I left Kenya and came to the United Kingdom to work in a nursing home. I started out in a nursing home, so don't be deluded that I started out in a hospital. I started in a nursing home. So I worked for a year in a nursing home. I got my UK pin, my NMC pin, and that made me a United Kingdom registered nurse. Ta-da! So after working for a year, I was like, you know what? I actually miss the hospital. I want to go and work in the hospital. So, being myself, I push for things. I am a go-getter. If I set my mind on something, believe you me, I will move everything that needs to move for me to get it. It's just who I am. Since I was a little girl, I push for things if I have to get them. And I decided I want that job in a hospital. And I know I do not have any renal experience. I've not done dialysis in the United Kingdom, but I've done dialysis back home. So, or I've worked in a dialysis center back home. That is the correct way to put it. Not that I was under dialysis, Catherine. You're confusing people. But my English, my English, I think in Kikuyu, translate in Swahili, then into English. So bear with me when my English is not perfect. Anyhow, Mimi huyo, I said, you know what? I am going to apply for a job in a hospital. So I applied, and when I applied, of course, my employers were wary to place me in a department that is a specialized one while only having experience from a nursing home. It does not happen easily. It does not happen. You really have to fight for it. Why? Because United Kingdom nursing practice, one thing I can really tell you guys is that they value experience. So if you have experience, actually you are likely to be paid more than somebody who has the educational qualification in that particular category or job or whatever it is. So here I was, knowing that yes, I only have a year in the United Kingdom as a working as a registered nurse in a nursing home, but I know my stuff. I know that I love I love working in the renal world. Let me say renal world for now, because you might not understand why I am avoiding to use the word renal unit. I know in Kenya, wherever dialysis is carried out, people call it a renal unit, and it makes sense in Kenya or probably in Africa or any other place. But when you come to the United Kingdom, it's actually not a renal unit. We call it a hemodialysis unit. Why? Because we have a peritoneal dialysis unit, we have a transplant center, we have a renal ward. There are so many different departments when it comes to the world renal or nephrology or kidneys. So allow me to call a hemodialysis center. Now, remember, when I was in Kenya, I had studied for a year in a higher national diploma in nephrology nursing. So that meant that in Kenya, I was a specialized nurse. But here in the United Kingdom, I wasn't. It was a problem, but what I did was actually fight for my space. I fought for my space. I really struggled, especially when I started getting paid £12 an hour. My God. I've never shed as many tears as I shed that time. I felt I felt misused. I felt underpaid. I felt overworked. I didn't like it. I truly didn't like it. So I knew that I had to fight for my space, one way or the other. So when you come to the United Kingdom as a renal nurse from Kenya, rarely are you going to be placed in a renal department unless you specifically say so in the interview, because you have to be very articulate and say, this is what I want. And I'm seated here asking myself, which is this employer in the United Kingdom who is going actually to take a chance on you that you know what you're doing, even without experience in the UK? I really don't know. Probably your best shot is to give it your all during the interview, but when you get that job, once you land in the UK, start planning a way to go back into the renal world. Because I don't know about you, but I love renal nursing. I love the kidneys. I love carrying out hemodialysis for patients. I love giving them an opportunity to be alive and to enjoy life once again, whether they have kidney damage or they don't have it. I mean, whether they have kidney damage or kidney failure or acute kidney injury, I really, really, really enjoy helping patients. I also like that camaraderie we form with patients, especially the ones who are on chronic intermittent hemodialysis. We are like a family, aren't we? I mean, if something were to happen to one of them, sadly they die, and it affects the whole team. I remember when I went back home last year, and I was told that there's a patient we had lost in the center where I worked in Kenya. I felt bad. I still feel bad, because I remember there's a time that particular patient was very, they were very personal when they were addressing me, especially when they learned that I was leaving for the United Kingdom. The patient said something that made me realize, oh, I'm actually important to this team, and you feel so sad when they die and a long story. Anyway, renal unit is amazing in Kenya. Same to in the United Kingdom. Now, renal nurses in Kenya, there's something you need to understand. You see, what you study for a whole year in college, here they study it on the job. So they are trained. You see what we do, preceptorship in Kenya, that we have the nurses who go for a 3-month course and then they come back, they just study a module and they call themselves renal nurses. That is what happens in the United Kingdom. So you're actually at a very high advantage if you are a renal nurse from Kenya, because I know the HND that we take in Kenya is quite comprehensive, so you can fit anywhere. So remember, when you are applying for that job, don't just look for band 6, for example. Try and identify which part of the renal department do I want to go, because there are quite many, and I will explain that in another video, which departments I'm talking about. So in a nutshell, you're not going to get any special salary. You're going to start at the bottom, and then you will advance. And what I would tell you is fight for your space like I did. Within 3-4 weeks, my competencies had been signed. I was cannulating patients. I was interpreting blood results. I was questioning prescriptions. I was, I knew my thing. And that gave confidence to my managers to know that, hey, this girl, she knows her thing. She's indeed a dialysis nurse. She might have worked in a nursing home, but she has the skills. She has the knowledge. She knows what she's doing. You understand? So that is the same thing you would do. I would say, come start at whatever band you're going to get. That is band 5. You're going to start at band 5. And then if you're lucky to get an employer who gives you a higher spine in the band 5 salary, well and good. If you get one who is giving you a bottom one, fine. Come and stay 2-3 months, learn the system, and then boom, move into a job that you really, really, really want. I hope this one answers your questions. What if you're in the United Kingdom and you want to become a renal nurse? Imagine it is as simple as applying for a job in a renal department. Hey, it's so ridiculous in this place. I can't believe it. Seriously, even if you want to be an ICU nurse in the UK, actually you can be very easily. Just apply for a job in ICU. They are going to train you. United Kingdom is very interesting. Do you feel like, oh, I left Kenya, I don't have a specialty, I want to work in theater and I don't have... Come on, no, don't worry. Just apply. You want to learn dialysis? Oh, I want to be a renal nurse. I'm in the United Kingdom, but I didn't train in Kenya. What am I going to do? Come on, darling, please just apply. United Kingdom trains their own. You're going to be trained. They are going to send you for that module. It's a renal module, and I have seen that the Association of Nephrology Nurses in the United Kingdom have started offering it as well. So many things are changing. Go and learn. Yes, you might be disadvantaged because they will teach you only what they want you to be quite conversant with so that you can work for them. Remember that. But in Kenya, we train in everything about the renal system, everything. So here I am knowing that if I wanted to be, if I'm taken to a kidney transplant ward, I'm good. If I'm taken to a peritoneal dialysis center, I'm amazing. If I'm taken to a hemodialysis center, I'm home. If I'm taken to a chronic kidney disease clinic, I'm actually okay. If you take me to the community to teach about kidney disease, oh my God, I'm fine. You give me chronic, you give me acute, I'm going to handle them because that is how we train back home. It is different in the United Kingdom. Yes, they are going to teach you or they will call you for these meetings and all that, but all I'm trying to say is do not despise your HND training in Kenya. That higher national diploma is very, very important for the sake of your own career progression. Okay? I really hope I've answered you. In the next video, which I'm going to upload shortly, I will be talking about the different departments in renal in the United Kingdom. And probably once I do this, you're going to know where do I fit in? Which job can I be on the lookout for? What does this job entail? What does this one entail? Okay? So thank you so much for watching. I really hope it has helped you. So until next time, ta-da!